Hi, and welcome to this week's video podcast. I'm Brent Dodge, and I have with me Leah Verstegen, a doctor of physical therapy and expert in the field of sport, both return to sport as well as sport screening. Leah, thanks for being with us today.
Thank you.
Can you give our viewers an idea of what sport testing includes?
Sport testing at Alpine Physical Therapy includes basically two components, the first of which is our return to sport testing program, and that is designed for athletes who are recovering from an injury. They've gone through their formal physical therapy rehab, whether it's been at Alpine or another location, and they're wondering if their body is ready to start returning to their full sport training, going into a preseason or getting back on the field. So we have a battery of tests designed to determine whether or not they're ready to return to sport. The second component is a sport screen, and this is designed more for the healthy individual. So if there's somebody, high school athlete or a mother of three who wants to get back to a sport, they've taken the summer off, they want to get back into football training, or the mom wants to start running again, they can come in and go through a battery of similar tests, but geared a little bit more towards the healthy individual to make sure that their body is ready to start training again.
You know, it seems like a lot of physical therapy companies could offer some sort of a sports screen. It seems like it's a little different and more intense on the return to sports side. What is it that sets apart the program at Alpine from maybe what another group might do?
It's a good question. We have recently brought in a lot of great technology. We have purchased force plates for all three of our clinics, as well as a pretty state-of-the-art video system utilizing just a simple iPad, but it has a real-time video application on it, so we can use the feedback from the force plates. The force plates are just two little plates that you set on the ground, and we have our athletes jump on them. They can just stand, do some squats. They can even get down and do a push-up or hold a plank position, so we can determine how much force is being distributed from one leg to the other, comparing a right side to a left side, same with the upper extremity. So the force plates are extremely helpful, especially after you've come back from an injury, a blown knee, where you want to know if that leg is accepting as much weight, as the healthy leg is. The video feedback helps the individual see where they may be completing an exercise incorrectly. We can video them while they're doing the exercise and then go back and show them.
I spent some time on those force plates, and to see the difference when there's a side-to-side difference and see that visually is a learning experience all itself. And I imagine that could form a baseline of information that someone could be retested, for example. How does that work?
Yeah, that's so a lot of times I will test an athlete and we will find a discrepancy. I think a lot of us are visual learners, so just having a physical therapist tell you you're putting too much weight on your right leg, well, how much weight? What does that mean? And getting to see a little graph that shows you exactly how much weight you're putting on your right leg compared to your left leg, and then you can watch that graph while you're doing your exercise and try to get your lines to overlap and make sure that your weight-bearing symmetry becomes a little bit more evenly dispersed. I think it's extremely helpful for anybody. We can teach them how to better incorporate their mechanics into their movement.
Now, the screening piece, is that something that you ever take outside of the clinic to go into the community and test athletes that way?
Yeah, definitely. We work a lot with Missoula community soccer players, as well as some of the skiers. We're starting to work with some of the tennis players and other sports. We can take the force plates and our iPads. That's the beauty of them. They're all portable. We can take it out to the field and do testing. We can take it to an area where they may be doing their own preseason training. At a gym, or for example, some of the skiers utilize a gymnastics area, and we can bring all of our equipment in there and help the kids or coaches learn a little bit more about what to look for to improve their movement, and then hopefully their performance, and in the end reduce the risk of injury.
I would imagine there's a lot of people, maybe they've been athletic before, they've been involved in a sport before, and they hear something, or maybe it's the first of the year where they want to get active again.
Sure.
And I'm just wondering, what would they expect? What could they expect if they were to call for an appointment and come in to set up for some type of a screen just to see where they are? What does that typically involve?
So it lasts about an hour. It's similar to going in for a physical therapy evaluation, except it's geared specifically towards that one goal of returning to sport. So they would come in, we'd do a quick interview, a basic interview, find out what their goals are, what their history is, what kind of athletes they've been in the past. And then we'll run them through a battery of tests, some flexibility testing, some strength testing. Then we'd put them on the force plates and watch their weight-bearing symmetry for upper or lower quarter, whichever we need to address, or both. And then we'd finish with some plyometric and agility testing. So that would include more of the jumping, getting into lunge positions, sometimes twisting, rotating, depending on what the sport is that they're gearing up for.
And if you could target your market for the return to sport piece, who is it that you're trying to educate and give ideas to on this program?
There's such a broad spectrum of people who could benefit from that program. It can go from the high school athlete who has recovered from a shoulder or a knee surgery and finished their physical therapy and then went for the next, typically physical therapy, we last 3 to 4 months, and then the athlete does some strength testing on their own. And right before they're ready to start some preseason training, they could come in and get tested. We can, as you mentioned earlier, we can test at the 3-month mark, give them some feedback, test again at the 6-month mark, give them some more feedback, and then hopefully by the time their season is starting, they know what they're supposed to be doing. Can also target the adult athlete, somebody like myself who has had a couple of kids and I want to get back to playing soccer, I want to get back to skiing, but I'm not really sure that my body is prepared for it. So I think that individual could also benefit from coming in and having a return to sport test or a sport screen.
Is there science out there backing up what you're doing with the biomechanics piece as far as potentially preventing future injury?
Yep, there is science that backs up a lot of it. We've utilized some of the testing from several universities around the country that is evidence-based, research-proven tests to determine whether or not you're at a higher or lower risk for injury. So we utilize a lot of those tests. The biomechanics, there are several programs. There's the most common one is called the PEP program, and it's an injury prevention program geared towards female athletes. We incorporate a lot of the evidence that has come out of these research studies over the years into our testing and into the feedback that we provide the athletes.
So parents out there with, their kids are playing various sports that have a question about the safety and whether their child is at risk for an injury, could potentially come in for an evaluation, and you'd be able to decipher that and actually set them up on a program?
Yeah, yep, definitely. I love working with the young kids. It's always great to get people in, the sooner the better. So as soon as your daughter or son starts complaining of a ankle sprain or a little bit of a soreness in their hamstring, they can come in and start with just a consult where they just come in and ask us some questions, and we can determine whether or not that individual would is doing fine but would benefit from the sport screen to give them a little more information on how they can better train for their sport, or that we could determine at that time if that individual does need a formal course of physical therapy before going into the sport testing.
I mean, it sounds like there's just an array of people that you can help with the program. How do folks get going on this thing?
The best way is just to give us a call. You'll see us out and about periodically at different sporting events around the community, and you're always welcome to come and talk to us. We're at the Missoula Marathon, we're at some of the Missoula Strikers practices, working with the ski team. If you don't see us in the community, definitely you can call any of the 3 clinics. We have sports specialists that can help you at all 3 locations and get you going on a program as soon as possible.
Well, that was a bunch of great information, Lee. I just want to let our viewers know that they're prepared and ready for the tip of the day. Today's tip of the day is
to remember that there are services available. If you're wondering if you're ready to return to your ideal sport participation, call Alpine Physical Therapy. We can set you up with a sport screen or a return to sport test as soon as possible.
I am one of the world's authorities on off-width climbing. It's a specific style of rock climbing that's considered the most physically brutal. I describe off-width climbing as ultimate fighting with a rock. I've been an off-width climber now for about 8 years, and I've had quite a few injuries. I've worked through all of those injuries with Alpine Physical Therapy. I can guarantee that without Alpine, I would not be climbing at all.
I'd like to give special thanks to Leah Verstegen of Alpine Physical Therapy for spending some time and just educating us about the sport screening and return to sport testing under that web page called Sport Rehabilitation. From there you can access the sport injury and return to sport page. We encourage you to get on site www.alpineptmissoula.com.